Hi, it's Dr. Lewis Clark, and I want to thank you for joining me on this series of videos regarding your thyroid, how it works, and how you can improve your thyroid function. That is really what type of care that we provide is functional health care, and I'm going to explain that as we go through this series. I want to tell you that I frequently get people calling me and asking me, hey, Dr. Clark, do you work with the thyroid? Do you work with thyroid patients? And of course we do, and that's why I'm doing this video to help people understand what functional health care is and the fact that there is hope that you can do better, because a lot of people are just frustrated because they are just taking their thyroid hormone, and they have been for years, and they don't feel any better. Well, let me say, first of all, that does not mean that you don't need your thyroid hormone, but in 80 to 90% of the cases, that alone will not stop your symptoms that you have, and will not improve your condition, even though the hormone may be necessary. And as we go through this, you'll see why. So thank you again for joining me. We're going to have this video will last approximately 7 to 8 minutes. And we'll be going through the basic physiology of the thyroid gland, how it works inside your body. Now, this is very important for you to understand. You may have hypothyroidism. You may have Hashimoto's. That may be the facts. Okay, but I'm going to tell you this. If your attitude is right, the facts don't matter. In other words, you can still feel better if you're willing to have the attitude that I'm going to do whatever is necessary in order to improve. And with our office, I'll say that we work with a lot of chronic health conditions, and they all have some common threads. They all have some similarities, and you can see a list of many of the different conditions and things that we work with, but you also see they all have these neurologic or metabolic imbalances, and many times they have both. And that's why we evaluate people in our office with a neurologic evaluation, meaning the brain and the nerves, as well as a metabolic evaluation, meaning all the organs and systems and how they're working, and especially meaning your ability to take food in and produce energy. That's what metabolism actually is. So let's get down to our subject for these videos, which is the thyroid gland, which you know is located right here in the neck behind your esophagus. And what does the thyroid gland do? Well, it does a lot. I mean, the thyroid hormone is literally like the spark plug to your cell. It has to be there to initiate and get the metabolism of the cell to happen. And so, yeah, it's responsible from everything from your bone health to your immune system, your brain and nervous system, your endocrine system, which is your hormones, your gastrointestinal function. You cannot heal a leaky gut or any kind of digestive problem if you don't have good thyroid. You're going to see that it's involved also even in insulin and blood glucose metabolism. Certainly cholesterol levels are always affected because of thyroid. Proper stomach acid and the production of HCl is all part of what the thyroid gland is involved in. So if your thyroid gland begins to underfunction, what kind of things might you experience? Because a lot of people come to me and they say, hey, I'm not sure if it's my thyroid or not, or hey, I went to my doc and he did my labs and he said everything was normal. Do you think this is my thyroid? Well, let me go through some of the things that are very common with thyroid problems. Now, first of all, people talk about hair loss and weight gain, and those are common. But the very most common symptoms are brain fog, constipation, okay, coldness, and muscle cramps. Those are the most common things that we see. It could be many other things as well. But here's the bottom line. Every cell in your body has a thyroid receptor. So guess what? Basically every cell could be affected. But again, when there's trouble getting the cell to function, getting cells to have proper metabolism, your brain is usually affected the most because it requires the most energy. That's why brain fog is the most common symptom that we see with a underfunctioning thyroid condition. So these thyroid receptors that are on the cell, they actually take in the thyroid hormone and take it into the cell, which you're going to see in a little while is extremely important. So what is the key to thyroid health? Well, thyroid is different than a lot of other systems because the key to thyroid basically is getting that hormone into the cell. So if you don't get enough into the cell, there you go. We talked about some of the most common symptoms: fatigue, weight gain, depression, constipation, coldness. Those are probably the most common, in the muscle cramps, especially while resting. But there are other things that are involved that you see here: skin conditions, poor circulation, bloating because you don't digest well, hair, yeah, guys too, and swelling or edema. But this is the most common by far, which is brain fog. Yeah, and that's what you feel like when you got brain fog, right? It feels like things are out of order. What if you get too much thyroid? What if too much hormone is getting into the cell? What does that look like? Well, too much hormone in the cell can cause things like heart palpitations, inward trembling, which is the most common symptom that I see, increased pulse rate, feelings of anxiety, nervousness, trouble sleeping, night sweats, and difficulty gaining or maintaining weight. Now, if you have, this is very important right here, if you have symptoms that go up and down and vary between these two, you probably have a condition known as Hashimoto's, which is an autoimmune condition, and it can cause both types of symptoms. We'll get into that a lot more. But I want to get into today, what I want to finish with is this information here about the complexity of the thyroid function and proper metabolism by getting the thyroid hormone into the cell. So you're going to see that everything, just like any other organ or system, everything starts in the brain. So the area of the brain called the hypothalamus, this is where you get feedback from your body to the brain so that it can make decisions about what hormones are needed. And so the brain will release something called TRH, or thyroid releasing hormone, which will talk to the pituitary gland. This is normal thyroid function or normal thyroid physiology. The pituitary gland is also found in the brain, and it will secrete an enzyme relating to your thyroid called, or excuse me, release a hormone called TSH, which will turn on your thyroid gland. So the thyroid gland then, of course, when it's activated because of TSH, it will begin to produce hormone, which is T4 and T3. Now, it's very important you realize the difference here is the number of iodine molecules that are found on this hormone. This one has 4, this one has 3, and you need an enzyme here called TPO, or thyroid peroxidase enzyme, which is going to be very important because that's the enzyme that is involved in Hashimoto's. However, here's what you need to know. T4 is 93% of the hormone that is made by the thyroid gland. However, T3 is the active form of the thyroid. So guess what? We're going to need some more work. This cannot get into the cell. This cannot help you until it's converted to T3. So for hormones to travel through the bloodstream, they need an escort, or they need a taxi or a shuttle. And that's going to be the TBG, which is thyroid binding globulin. This protein is going to transport the thyroid mainly to the liver, the T4 to the liver. Some is going to be converted in the gut. Some is going to go to other tissues and not be converted at all. But this is going to be converted then to T3, which is the active form of the hormone. Now it's going to go into the blood. It's going to become free T3, which means now that it's going to get off the thyroid binding globulin, attach to the receptor, and go into the cell. That's what we call normal thyroid physiology. As you guessed, there and you've seen, there are a lot of moving parts here, a lot of different places where things might go wrong. And because of that, okay, the next video in our series, we're going to focus on what the blood tests are and how they can tell us where things might be going wrong. And we're also going to dig a little deeper into what happens inside the body as this process goes through. So I want to thank you for joining us on this video, and I'll look forward to seeing you on the next video. Be sure, if you like this, let us know, comment and like and share it with your friends. And if you haven't already subscribed to our YouTube channel, do that, because you'll get a notice when we're going to do the next video in this series. So until next time, God bless and live life well.